I made up this title specifically for this lecture today because it's something I've been thinking about and writing about for quite some time, and I keep coming back to it, that the expressive work, the arts, are really ancient practices that were restorative, and I'm going to go into that first. But now the fascinating thing to have been in this field so long for many decades, to see that neuroscience actually is helping us find out why these practices have been happening for thousands of years. So there's so much, it's just snowballing in terms of research. And I will say, and I'll show you another slide here in a second to give you an idea of where I'm situated. Catherine described a little bit of it. The field of trauma, of psychological trauma, a lot of this data is coming from there, but it's coming from a lot of different places. Developmental, autism, all different quadrants of challenges that people have in different ways. So that's where I want to focus. And in the second half, I'll go more into that area of what we're learning about how fascinating and how important these approaches are. So Catherine already mentioned this. I actually started out working in trauma as an art therapist and play therapist many decades ago, and working with children who survived what was then called domestic violence, but there was also child abuse involved, interpersonal violence involved. And that was kind of my starting point, my foundation. Now, I say that now and think back, we didn't know much about how art-based approaches worked. We didn't know much about how trauma affected the mind and the body. And, we've come into a decade here where research is emerging so quickly and so very connected to why we should use the expressive approaches that I'm going to try to introduce today in the talk. And also, in my current time, just again to situate you, work a lot with the military, started out working with, of all branches of the military, the Navy SEALs, and work with the Army, work with families, work with active combat military veterans, and particularly female military who have survived interpersonal violence in their role in the military. So, all this is kind of a long continuum for me, and starting out in that work of violence and continuing it into the present day. And I will say, military are one of the largest adopters of art-based approaches. It really resonates with them in their challenges with post-traumatic stress and some of the other things that come along with that. And the second piece is the U.S. Department of Education grant, which was a surprise about a year ago to find out that I was part of a grant to introduce trauma-informed expressive arts therapy to classroom teachers and help them introduce it into classrooms. So we're in our second year with that. So there's a wonderful learning curve there, but also a lot of data already coming about to show the efficacy of that in both, not just the classroom children, which range from age 5 to 17 or 18 years old, but also the teachers themselves, which I think is phenomenal at this time when a lot of teachers are very stressed by what they've had to go through over the last several years and other things that are challenging about the classroom. So here's where I want to start, is expressive arts therapy, and I want to give you a baseline definition for that because it's a little bit different than what we call creative arts therapies. But what my focus is the idea of expressive arts therapy that really is, in my mind, and if you see the pictures here, some of the different art forms that go into it, it's both an ancient, which comes from our cultural anthropology and ethnology and those areas of study, and also a contemporary practice. It's a contemporary treatment as well. I think this is a fascinating thing because it speaks to humans' ability to find things that will be helpful and reparative and restorative. And I think expressive arts therapy, if you had to really pick one thing that it will keep coming back to today, it has a lot of restorative components to it. And I think we don't talk about that so much even in treatment of either patients physically or emotionally, psychologically, the idea that there are practices that not only reduce symptoms and reduce the feeling bad, but can replace those feelings and those experiences with something that is restorative. So keep that in mind as I go through this, because I think that is a core principle of expressive arts therapy and all the art-based approaches. So I just want to start here with what is expressive arts therapy for those that may not have heard me talk about it before or read any of the literature about it. You hear a lot of different things. You hear about art therapy and music therapy. You hear this term creative arts therapies. Expressive arts therapy distinguishes itself, I think, by this one principle of thinking about all the different art forms. So visual art, music and sound, dance movement, drama. I even include humor and play in this, creative writing, all used by many different kinds of practitioners in psychotherapy, counseling, and healthcare currently. Expressive arts therapy is an integrative approach. We really seek to combine these different art forms in different ways for people depending on their needs in order to help them tap their senses in various ways. And again, this is not a new concept. This is something that people have done for thousands of years, combine the arts in ways that were restorative for themselves. So when we talk about creative arts therapies, we're often talking about various areas that people are trained in and get expertise and skill in. So I started out in the field of art therapy, which is visual art. Other people may have started in music therapy, dance movement therapy, drama therapy. Those are the four core approaches. They form the creative arts therapy. When I talk again about expressive arts therapy, I'm always thinking about how I can combine those various areas. And that just happened along the way when I saw that people who needed intervention with trauma needed multiple kinds of experiences. So, somewhat personal to me, but it's also a field. And it's a field that you can study in various ways, but it has some core principles, I think, that are important to mention here. It's action-oriented. I say implicit because a lot of the work is nonverbal, even though we do talk during our expressive arts therapy sessions. And it's very sensory-based communication because, again, infusing sound, movement, image making, enactment, maybe role play, all those things are very sensory-based and, very much used to address a lot of different issues and challenges. One of the things I think a lot about, and I think this is true of the field of expressive arts therapy, is its goal is to really help resensitize the body and mind to positive sensations, emotions, and thoughts. We may treat symptoms using it, but also we have this ability to increase that capacity in those areas. So I'm coming back to that restorative practice idea. Keep that in mind as we go along here. So here's something I recently wrote about in an article and then wrote about it in a handbook of expressive arts therapy that came out recently that, really is expressive arts therapy the original psychotherapy? We think of psychotherapy as talk therapy, and that's been around for 150 years or more formally as a discipline in psychiatry and in all the different kinds of psychotherapies where you come in and talk to somebody. Before that, there were thousands of years of people using other kinds of methods that may not have been talk per se, but in the form of movement and sound and art making to really do that kind of restorative or reparative work. So, here's just a cultural anthropology view of this. And I think this is worth thinking about, even in terms of the current research that is being done in the field of expressive arts therapy and all the arts therapies, that this original psychotherapy emerged as rituals and spiritual traditions, these things we still have amongst us. Imagery, sound, procedures, ceremonies, and often they were in direct response to trauma and loss. So sometimes we look at all these images here of people dancing, playing music, making image, enacting as art forms. But really their purpose, throughout history has been to help people also return to psychological, physical, and social equilibrium. So, this is a longer tradition than verbal psychotherapy, that nonverbal implicit communication has always been valued as reparative and restorative by humans. It, definitely came about before language. And the interesting thing is when I get to the neuroscience area, this makes a lot of sense. So when I get to that, keep this thought in mind too, that there is a connection about why we started with implicit nonverbal kinds of ways of healing. So, the other thing I think is really fascinating about expressive arts, and also art therapy, music therapy, drama therapy, dance therapy, all the domains, that go into it. It's very culturally driven. This is the one thing that we can find in the art forms is very personalized cultural traditions, sensory-based, according to the culture of rhythm, of synchrony, of moving together and training together, feeling what's inside the body, the felt sense, and the embodied communication. So, right now in the field of expressive arts and the other art forms, we're thinking a lot about this, what the body-based kind of experience is for people. And for many cultures, this is a more important way to help and assist and enhance their reparative and restorative experiences through the body, because the body, can feel these kinds of changes through all these different art forms. And I also say, essentially this is an asset-driven resilience kind of focus, more so than the symptom-driven that sometimes infiltrates psychotherapy. The arts are really about efficacy and mastery. So, it's really interesting with the resiliency lab there in Colorado that this is probably the one form of therapy that really meets that definition of how do we build resilience, because this is really naturally about that. It's about self-agency. It's about mastery. It's about finding those things in one's body that feel enlivening, that feel joyful, that instill curiosity. The other thing that I think is interesting about this, and of course it happens in group work in many forms of therapy, but it's very relational. And you can see in all these pictures, people engage together, in the art forms is a very important piece, I think, of the healing engagement that is found in expressive arts and all the different creative arts therapies. And then also I say restoration of identity, really finding a new identity and imagining a new narrative through expression. This is a really core thing too. So, you can think about expressive arts therapy as, defined by these, and also all the creative arts therapies, your art therapy and music therapy, again, dance movement therapy and drama therapy having these qualities. So this is what I want to spend a little time on before I get into the neuroscience piece, is a four-part kind of introduction here, and thinking about expressive arts in terms of where it really came from culturally. And over the time of researching for one of the last book that I did in the book before, I thought a lot about this cultural impact and talked to a lot of anthropologists and, got their take on what they thought were the main practices. And they really do fall into four areas. One is movement. I'm going to show you some slides here in a bit. One is sound, one is storytelling, and the last is silence. So I'll describe those here in a second. I also want to share this slide with you because this is more focused on the trauma work that I do in thinking about those four areas. These are the four areas I think about now when I'm working with someone to find out different ways they can experience things and communicate through any one or more of these areas of movement, sound, storytelling, and silence. So let me just go through, because I have a little bit of film footage too that'll kind of help you get more of a feel for this, because it's very hard on just a flat lecture here to get your sensations going a little bit. But movement, I think, is the one that is the foundation of all the expressive work. It becomes very important in trauma because sometimes people get frozen in their feelings and they need to move. But when we look at it as a cultural practice, there's so many different things that fall under that category and can be part of the expressive work. Obviously, a lot of people think about dancing, but there's yoga, what I call bilateral movement. There's sensory integration. There's classic cultural practices that still go on in the world. Tai Chi, Qigong, Aikido. There's also cultural practices of the hula, of Sundance, which is in the Native American community, corroboree, which is in the South Pacific and New Zealand and Australia. And then there are restorative movements that we can introduce to people in the expressive work. So I just want to share this one to just give you a visual. It is just a few seconds long here, but it is a group of practitioners that I worked with this summer in Australia, and they are demonstrating the experience together in movement of being held. So that's just a lovely demonstration that those psychotherapists were willing to work on and present to our large training group. But it really demonstrates what the core of movement is and expression is, and it's been this way for thousands of years. The synchrony between people, the connection between people, and the attunement between people. And, you know, we can talk about that with someone. We can do it as a therapist and a client, but in this kind of setting with this kind of a sensory experience, you really start to feel that synchrony and that attunement come alive. And I think, you know, this is one of the powerful things about expressive work, that we can actually introduce this to people in very simple ways to help them experience this very, again, reparative and restorative kind of experience. So here's sound, and I just want to show you a little film here. You know, sound we return to constantly in our lives, especially music, when we feel distressed or we feel a loss. And I don't know how many people remember, not that long ago, a few years ago, the burning of the Notre Dame Cathedral, and people spontaneously coming out into the world to sing to the cathedral. But part of this is gathering together, to be together, to make sounds together, to experience again that synchrony and that attunement together, but using music as a way to express the emotions, but also feel more restored in oneself in this action-oriented moment. I'm just going to stop that there for time, but you know, all the things in sound that we can do with singing and drumming and playing instruments, but there are very simple practices we can do expressively with people. Humming, if you think about chanting and prayer, that's sound, that's repetitive, that has an impact on people's restoration. Even listening to music, you know, or experiencing certain kinds of vibrations from sound. Or we all know now the research is exploding over the last 10 years about how important those experiences are. So, you know, sound is another piece. I'm going to skip a slide here just because we don't have so much time and go on to storytelling, which again, can happen in a lot of different ways. This is another practice that's been handed down for thousands of years. Sometimes we think, okay, that's verbal, right? And it can be sharing a story to others and having that story be heard and witnessed. But we can have this in dramatic enactment, in drama, in role play, improvisation. excuse me, also through image making. You can see, you know, these folks in the masks, but also the images here. So people can do this in different ways and express stories. This becomes really important in trauma work because sometimes people don't have the words for what's happened or don't want to share those stories in a verbal way out of fear or other kinds of powerful barriers to expression. But can be done, storytelling can be done in so many different ways, as we know from our history as humans, that there are many different ways to express that. Also, ceremonies and rituals throughout time have been able to express stories that are handed down through cultures. So storytelling, again, boy, a lot of diversity here, crossover maybe into some of the movement and sound, right? But another powerful piece of cultural reparative, restorative work. And the last one is silence. And I think a lot of times immediately, you know, if we're in the fields of counseling or psychotherapy or working with people, we think about mindfulness and meditation. And certainly that's a form of silence. When we add being in an art form, being expressive in an art form, in a mindful way, in a meditative way, in a contemplative way, that also is, you know, part of that silence. And art making, we know, out of many of the different expressive forms, art making and music are very powerful at helping people when you give the right circumstances and direct a certain form of expression with them, helps silence the body. And when I say that, I'm talking about self-regulation, how it calms the body, reduces cortisol, brings the heart rate down, decreases the sense of pain perception, even in some instances. So we know a lot about music and art making as ways of silencing the body when, you know, we give a certain kind of experience for people to have. And that's, you know, again, restorative on many levels. And certainly that comes from, you know, again, thousands of years of cultural experience with this. I want to just point out here that witnessing an art form, whether it be theater, performance, museum works, so works up on a wall, these are things also that we know now. And we learned this before the pandemic when people could gather. We're getting back to gathering again, but going into theater together, hearing a performance, hearing a concert, looking at art on a wall together. People started to entrain and started to breathe at the same rate, depending on what they were looking at. But again, that experience of synchrony, but also silencing and quieting the body in some way. So that is a very powerful area of study that comes out of the arts and healthcare for the most part. And there are actually now a lot of museum projects involving art therapists across the country and in Canada that are getting similar data about the really powerful restorative effects of just witnessing and being in a group. Witnessing together is really what is the most powerful and reparative. So I'm going to jump in here quickly from ancient to modern and give you a little bit of highlights about what we're learning in neuroscience, about how and why expressive arts, creative arts all support health and well-being. And there's just so many things coming about. But these are two principles that I learned early on. They're a little bit older. They come actually from the 1990s, the late 1990s. Expressive arts, expressing in an art form, is really this implicit non-linguistic process. And Antonio Damasio, a neuroscience researcher, who's written many, many books over the last couple decades, really identified that all language does not actually come from the left brain. It actually starts as a non-linguistic process in our right brains and emerges from the right brain and precedes language. So, you know, really supports this idea that we do have a communication center that may not be language oriented, but it actually stimulates language. So I think this is one of the powerful things that all people in the art-based approaches know, that they start to get stories from people sometimes those stories start to come out in language when they were unable to express them in any other way until they created an image, until they did that movement, until they experienced sound in some way. The stories started to emerge. So he had a really, excellent explanation for that based in his research back in 1998. More recently, but actually in the 90s at first, Bessel van der Kolk really pointed to the idea that traumatic experiences are not always encoded as explicit memory, which is declarative with words, but they might be stored as nonverbal sensory fragments. When I first read that in 1994, it really set off a light bulb in my head about, wow, this is why I think these things are working. People that are traumatized may not always have the language because of the distress of the trauma, and things were encoded in a different way in the brain. Now he went forward in 2014 and New York Times bestseller, still #1 on the paperback list, Body Keeps the Score. So he followed that whole idea that the body knew what was going on before it could articulate through words. So there's some powerful evidence there. So what I've kind of found, just in the work in general over these decades, is what neurobiology is teaching us is really about helping people come to their senses. And we really can't just do that through talk. We can do that in other ways that are implicit. And one of them, of course, is this expressive work. And that's a really important and also, I think, key to developing any kinds of components for addressing trauma, which I'm always thinking about in the work that I focus on. And this is a way also for people to tell stories of traumatic events through nonverbal implicit forms of communication. So this I think we know now from way back from Antonio Damasio, and now fast forward to 2022, that these senses are really important to tap in certain ways to help people be able to express what's going on when the words are just not there or too frightening to talk about. So here's a little bit really quickly about where trauma research is going with expressive work. And part of it is to treat what we call the lower brain to address these sensory reactions in the body first. This is all about sensory processing and sensory integration, and this is the area that trauma researchers are really focusing on. So again, with expressive work, we don't necessarily tap senses so much through talk, but when we're engaging somebody in something tactile, visual, auditory, all these different things, we're starting to use that platform of sensory processing to help them communicate, to help them understand their body's reactions, but also express and release and repair some of the things that have been distressful in their lives. So here's one concept. I call it embodied cognition. It's a term that's mostly used in the education field, but we're really learning that, again, get people in motion, doing something action-oriented, helps tap the body's senses of what's going on, and also helps them learn more and experience more than talk alone. So I'm just going to play this little film here while I'm talking. Somebody doing some bilateral work, both sides of the body, drawing. This is a good example of expressive arts work because we're combining something here. I could be playing music too and creating a rhythm that she could be following. That would even bring it to another dimension. But all this pattern, repetitive rhythmic activity, walking, running, dancing, singing, art making, even repetitive meditative breathing, these are all kind of around the topic of embodied cognition, and really starts with just sensory experience. She's not working on making anything here in particular, and just, going with the movement. So, this is one of the things we're looking at in the education grant and helping children and young adults, actually all the way up through young adults, to experience this kind of bilateral movement and find out, what does this really do? How does it impact the person? And again, a combination of different expressive arts forms. So here's another piece too to think about is the idea of all these things that go into expressive arts. So rhythm and movement, synchrony, entrainment, but the idea of sensory integration. And this is the big thing now in trauma research. And I think it really fits well with expressive approaches. It's giving us a lot of data about what we should be doing. And, sensory integration is a big topic. Would take another hour, but we talk about our internal sense, which is our interoception, our five senses, what's going on, what I'm hearing, what I'm smelling, what I'm seeing, all these different external senses. Proprioception, where is my body in relationship to everything around me right now in this room? And vestibular function, if I was standing up, what is my balance and gravitational security? How do I feel that? All these things are impacted even by psychological trauma. That's the latest work that's going on, is thinking about how people's senses are thrown off by trauma. So, I think a lot of people that we see who have various challenges, they might fall into this category of having trouble with sensory integration. And often in trauma, what happens is there's a disconnection between the outside senses, those five senses, and understanding what's going on in the body, the interoception. So that's one of the things that expressive arts offers numerous approaches to support people in reconnecting those two experiences, because oftentimes they get disconnected, or people don't want to sense what's going on inside for good reasons, because it feels uncomfortable. Gradually being able to reintroduce their sense of felt experiences in the body. So, I think this is one of the things we're learning, that expressive work has to happen in order to have these two things connect again, that we can't talk people into it. We have to give them experiences so they can re-engage with their internal sensations. And I think I'm coming down to the last few slides here. Co-regulation, just going to go briefly over this. A lot of positive social engagement that goes on. Now, here's a good example here with drumming, percussion, doing things together, being able to be in synchrony with the therapist, being able to be in synchrony with a group. And what's different about it, again, than just having a synchronous conversation, we're bringing the senses in, we're bringing rhythm in, we're bringing movement in, we're bringing different forms of expression in. So really solidifying that co-regulation that's so important for humans to feel and sense that they're connected to someone else. All relationships, all healing, I always say, all healing ultimately takes place within the context of a relationship. In expressive arts, we really add the senses to that. And of course, talk therapy, there's a lot of relationship in that, but we don't have this experience of synchrony, moving together, being in connection with each other on multiple sensory levels. So this is another thing we're starting to learn about, and working a lot on this idea of reflexive convergence in the Department of Education grant, that there is an importance to multisensory interactions and relational moments in expressive arts therapy. And that those support these really important things that are reparative and restorative: mutual trust, connection, understanding, and even empathy. Those are the things that we're looking at in that. So, you have to introduce the senses in some way to get that kind of experience going. So here's my last thought here, and then we can stop and have a little discussion, or have Catherine field some questions. This is the thing I think that's really the takeaway here about expressive arts therapy, all the creative arts therapies. Again, art therapy, music therapy, dance movement therapy, drama therapy, play therapy, even, for example. They support capacity. And this, I think, really fits your model when you're looking at the arts as a form of resiliency. Again, we can have that discussion with people. We can make suggestions to them about how to build resilience. But resilience is something you feel in your body. And it's really is a capacity that can be developed. But we need to bring in something sensory-based. We need to bring in something that's action-oriented. We need to bring in things where people can feel felt and feel felt by others, can experience something through doing, can experience something through all these multidimensional experiences of movement, of sound, again, of, image making, of storytelling, of being witnessed. So, this is what I think about a lot right now in work with, whether it's the military or whether it is the classroom and the classroom teachers, that mental illness, and we'll include trauma there, all these physical challenges that people may be coping with, they're not just what we're having to treat. What we have to do is also think about how do we expand the capacity for resilience, for enlivenment, for self-compassion, and for curiosity. I'm going to emphasize that last one here on closing, because what I've seen over the years and working with trauma survivors and other populations, medical populations that have had life-threatening illnesses, for example, fear is something that takes away that curiosity. But when we're introducing expressive work, we have all kinds of opportunities to introduce curiosity, whether it's like, here's some new art materials, let's see what they can do. Let's see what this drum can do if we beat on it in a certain way. What do these sounds do? How do we feel about these sounds? And how can we reintroduce being curious to those experiences? Those are the moments that really start to expand people's capacity. They expand the capacity for them to start to be curious, to start to be playful, to start to feel their own bodies again in positive ways, empowering ways, and resilient ways. So that's where I'm going to stop because of time. I'm looking at my clock here, and I guess I'll jump out of here.